here we have another patient who came to us with complaints of facial asymmetry, and if you see both the sides, compare it, you see more asymmetry on the left side, more fullness as compared to the right. What we are going to be performing is a bilateral angle osteoplasty, mainly to correct this jawline, this flared angle right here. Apart from that, we also intend to do some work on the chin and the malar bone as well. So we will be doing malar osteoplasty, genioplasty, angle osteoplasty. That is the plan for this patient.
More proportional, get the chin forward. We're going to get the angle inside, like facial slimming. She also has facial asymmetry. She's not very visible now, anesthesia, but you can see the left side of the cheek is more swollen outside. So we're going to be working on that side of the cheek as well. And this is before we start the surgery. So we've just completed with this surgery now. So we advanced the chin both in the horizontal and vertical dimension by 5 millimeters. We've contoured it, jaw sculpting. We reduced the width at the angle. We're going to show you how the patient was before. Okay, we're going to show you the front view as well. Mind you, there's still a lot of swelling, especially in the angle region, because of the work that we've done both in the bony part of the mandible and on the masseter muscle. So she had a very squarish face, as you can see there. Squarish, boxish, like broad. So we've made that more angular by working on the chin and the angle. And we also sorted out the asymmetry at the same time.
हाँ, उसकी वजह से दर्द हो रहा है, ज़्यादा नहीं हो रहा ना? ठीक है। हो गया 1 मिनट। हो गया स्लोली। इतना दर्द हो रहा है? हाँ? बहुत हो रहा है। सॉरी हो गया 1 मिनट। 1 मिनट। हो गया बेटा, 1 मिनट बस 1 मिनट। वो ना यहाँ पे जो चलो नहीं 1 मिनट नहीं आप बस टेंशन में आराम से। साइड देखो, ये साइड साइड कटे। We done on the angle also for a little bit right here. अरे मत अभी हो गया। दर्द हो रहा है क्या आपको? अभी दर्द हो रहा है?
यहाँ ज़्यादा होता है, मतलब
अभी दर्द नहीं होता लेकिन
इतना नहीं होता, अभी नहीं हो रहा है।
ठीक है
आपको बहुत ज़्यादा होता है।
ठीक हो जाएगा, ठीक है। हाँ, विल टेक अ स्कैन फॉर अ। आ जाओ, विल टेक अ स्कैन फटाफट। आज जा रहे हो कि कल जा रहे हो? हाँ।